This is the state of healthcare in besieged Aleppo. The chief of the health directorate of rebel-held Aleppo province says they now have to play God's role, that is to decide among the injured who gets to live and who dies.
The shelling led to about 200 casualties a day. Our medical staff in Aleppo became unable to help and provide necessary support to the casualties. With so little supplies remaining, we ask ourselves who should be helped and who should be left to die. The world continues to watch us and what we do as doctors inside the city.
Now that the neighborhood of Hanano has fallen, what do you see happening in the next few days? Will it be more difficult for you and your colleagues to work inside the city of Aleppo?
We have put a plan to distribute medical staff to provide necessary first aid. We work as hard as we can, and we know the regime aims at dividing Aleppo. This distribution is not easy. There are so many challenges facing us in moving the wounded from one place to another. Petrol in Aleppo is rare. Only a few vehicles are available and the road network is destroyed. If we manage to give first aid to patients, we can't move them to a hospital in case they need surgery.
So, Doctor, describe to us what is the situation on the ground inside the besieged city of Aleppo and its outskirts.
The regime kills and shells hospitals and children, but we are also determined to bring up a healthy generation for Syria to be rebuilt. I have seen wounded pregnant women where the doctors managed to save her baby's life, but she died. I have also seen cases where doctors managed only to save the mother whose baby died because of the shrapnel. The regime wants to take lives, but we won't give up trying to save lives as much as we can.
Do you have any hope, and what are your appeals to international countries?
Doctors are part of huge numbers of civilians under siege. We need to stop all attacks against civilians and hospitals. We are paying the price for only wishing to express our opinion. We need to have all hospitals, medical facilities and centers, ambulance services and medical equipment and supplies to be protected. The regime does not abide by international norms. As doctors, we took the Hippocratic oath to save lives. It's not an oath to watch the sick and wounded get killed. Doctors of the world are now supposed to do something to protect us. It's a human catastrophe. The international community has to do something. The regime does not care about us, about our families, and about our lives. We urge all local, regional, and international organizations to take measures to stop the barbaric attack against besieged Aleppo.
Medics are pleading that there are massacres being carried out in Aleppo, and more will happen if the world doesn't interfere. Osama bin Javed, Al Jazeera, Gaziantep.